JP is morphing into his avatar. Look, Hannah's morphing into her avatar too. Now Shunmugam is morphing into his avatar. Bad has arrived, and he is morphing into his avatar.
I don't really buy into this synthetic claims data stuff. It just sounds like fake data to me.
Why do you say that? Do you think it can't be clinically sound? Or that it can't be genuinely novel?
Honestly, both. It's really hard to generate data that's clinically accurate and novel at the same time. Usually you get one or the other, not both.
Until now.
Whoa, hang on. What do you mean by clinically accurate?
Clinically accurate means the data obeys real healthcare rules. A surgery can't happen before a diagnosis. Medicare is the primary payer for people 65 and older. A drug can't be dispensed before it's approved. Asthma drug usage peaks in September and December and is almost non-existent in June and July. And it's not just about individual records, it applies to groups too. Women are about 4 times more likely to have headaches than men. Patients with ER-negative breast cancer are more likely to have ovarian cancer as a comorbidity than those with ER-positive breast cancer.
Thanks, JP. So what was the other thing you mentioned? Was it novelty?
Right. Novelty means you don't want synthetic data that just mimics the real data. A few shifted dates or events swapped here and there isn't enough. Good synthetic claims data should tell new patient journeys, ones not already in the RWD.
Got it. So you're saying Hannah is skeptical because she doesn't think we can produce claims data that's both clinically accurate and genuinely novel.
Exactly. That's why I'm skeptical.
Let me jump in. GANs, generative adversarial networks, and VAEs, variational autoencoders, got so popular because they've done great things. Deepfake celebrities that never existed are a perfect example. But those methods are good at generating individual events, not sequences of events that must obey clinical logic. There are also genetic algorithms with crossover, mirror, and mutation operators. They can be impressive, but a single mutation can break the clinical integrity of a patient timeline.
That's right, bad. That's exactly why we built a new method to power our SynGen engine.
So how does SynGen actually pull this off?
SynGen does use operators, but not the kind Bad was talking about. The operators in SynGen are designed specifically to preserve clinical integrity, and the framework itself supports novelty as a built-in feature.
That's awesome. Here's an idea. Why not run a test with data SMEs? Show them a mix of real and synthetic patient records and ask them to tell which is which. If they can't reliably tell them apart, that would show how seriously synthetic data should be taken.
We actually did that. We adapted a triangular test from wine tasting. We replaced wine samples with patient data, and we asked participants not just to pick which are RWD and which are synthetic, but also how confident they were. 100% sure or probably.
Wow, that gives me a lot to think about. Let's definitely keep this conversation going. Talk to you soon.
Okay, bye.
Bye. See you soon.
Great conversation. Bye.